So all of us on this panel have gotten a lot of conversation from our patients about coming in for well visits. So here's a question for Dr. Sirota. I am worried about bringing my children who need vaccines to the office for their checkups. At what age and for how long is it safe to delay my child's vaccines?
So I want to sort of do this in two parts, if that's okay. I want to talk about the things that most pediatricians are doing so that we can make our offices as safe as possible for you to come in. But I also want to talk about delaying vaccines, and I think I'll start with that first. It's never safe to delay a vaccine in a healthy child, not for any shot and not for any disease or for any reason. And as was already alluded to by Dr. Strauss, during a pandemic, the last thing that we want to see is an outbreak of some serious vaccine preventable disease like measles. And for those of you in New York, you already know what it was like to deal with a lot of measles cases, not so far in the past. And we certainly don't want to see that again in our country or really anywhere. But this could truly happen because many of these diseases that are vaccine preventable could have a resurgence if people delay taking their children in or altogether skip vaccines. And in fact, the diseases that are prevented by vaccines are generally far more serious in children than what we've just described to you that we're seeing in children from COVID-19. I think it's also important to understand when we ask about delaying, and I think Dr. Fierstein, I think you made this point last week really well, but I'll repeat it for people who weren't there, is that the early vaccines we give, particularly in the first 18 months to 2 years of life, they are not boosters. These are part of what we call the primary series for vaccines. And what that means is it takes all of those shots at the time that they're supposed to be given in the way that they're supposed to be given to provide the protection that we want children to have for these really serious diseases. So we give vaccines a lot. We give them at 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months. And then throughout all of childhood, we give boosters for all of those things, and we give vaccines sometimes for the first time for prevention of cancers like HPV, or for very serious meningitis that we can see in teens and young adults. So there is really no time where it would be a good idea to delay and or skip vaccinating altogether. And I hope we drive that point home. So how can you feel safe then coming into our office now that I've given you the idea that it's not a good idea to delay vaccines? So let me tell you about what practices are doing. Doctors are separating when or where they see sick and well patients. So they create times in the day that are exclusively for well visits. The office has been cleaned in a way where no sick children have been there, usually for many hours, including overnight. We ask only one healthy adult to come with each child rather than all the siblings and sometimes all the parents. We screen parents and patients ahead of time if they're coming for a checkup visit to make sure they've not developed symptoms. We do things like check temperatures on patients when they're coming into the office. Many patients are wearing masks. Our staff are all wearing masks. We take temperatures on our staff, everyone working in our office every day. And then we do as much as we can that we would normally do when you come into the office, like stopping at our registration desk or spending time in the room talking and answering questions with our nurses ahead of time. We're not doing that anymore. So that's happening prior to your appointment, maybe before on the phone or maybe from the parking lot before you come into our offices. And we maintain social distance. We don't use our waiting rooms. We bring patients in a staggered way, so they go straight into a room, they're met at the door. And I think we're a little bit like the grocery stores these days too. You're coming in one door and kind of one-way traffic out the other way, so that when you're in our offices, it doesn't feel like it usually does. It really feels like you're the only one there. So these are the things we're doing. We've really shifted so that we can make it safe and do our part to help you keep your kids healthy and in a safe and comfortable way.
Thank you. I agree wholeheartedly that well visits and vaccines are important. But the next question is, I want to keep my well appointment, but I'm afraid, can we do our well visit remotely? And I'll answer that one. Up until last week, the idea of a telemed well visit didn't exist. But the American Academy of Pediatrics came out in favor of telemed well visits when there's no other way around it. So I think we can all agree we'd rather see you in person. We want to touch and feel. We want to use our stethoscope. We want to see you. We want to be able to draw blood and do a hearing test and do all those other things. But sometimes that's not possible, either because of your health and you can't bring your child in because of risk factors like we talked about, that risk benefit, or maybe you just can't get over the fear. And then there are visits where there are no vaccines needed. So is it still important to get those visits? And I would suggest that the answer is yes. Because look at the situation. Can you say, well, can I have my 6-year-old well visit in a month? The child's healthy. There's really no concerns about that. And yet in a month, you probably could do it. But what's really going to have changed in a month? In a month, we're not going to have a vaccine. In a month, we'll probably have released some of the rules, maybe. If it's not in a month, then it's in 2 months. And then you're going to have more people walking through the office. The dentist in my building, who's now closed, is going to be open. So is that really better to wait in a month? Plus, what's the chance that you're going to get to see the doctor that you love for that double checkup for both of your kids that you planned on a Saturday in a month or two when maybe you're back to work? And when everybody in the practice who's thinking the exact same way you are is trying to schedule those same appointments. So if you keep your telemed well visit, you can do all the parts of the checkup that are by talking. And that really is the longest part of the well visit. Now that may be enough for a younger child, a 5-month checkup, maybe even a 21-month checkup where there's nothing going on and vaccines aren't needed. For anybody that only gets a yearly checkup, they are going to need a secondary supplemental exam where the doctor does listen to your heart and feel your belly, where we do our yearly screenings. Because we can't, in good conscience, sign a form saying that you're safe to go to school and camp and play soccer when all those things resume if we haven't seen you in person and actually listened to you. But that's going to be a much shorter visit. And right now, the thought is that that second visit, based on what they're advising us, there will be no copay for that. So your first visit is a well visit, whatever your normal payment structure is for that. For most insurance companies, there's no copay. And then the second visit would just be a supplemental visit, unless, of course, at that point you had another issue that you wanted to bring up. And then how lucky of you that you have your doctor right in front of you in a pre-scheduled appointment. So in-person exams are best. Vaccines must be kept, but well visits are an option by telemed.